Hello dear viewers. Today I'm going to show you the supraclavicular brachial plexus block. Here you can see I have placed a pillow behind his shoulder. That is, the positioning is the most important part of this block because I have found that in many patients, placement of a pillow behind shoulder improve the visualization of the brachial plexus. So now I will place the prop. I will keep the indicator towards the patient and I will place the prop just behind his clavicle, mid clavicle actually. You can see how I placed my prop. Now, this is something you will see. So, you will not get this type of picture in every patient. So, let's see. This is the subclavian artery and this is the clavicle. I will come back to it later. So, if you don't get this type of view, you need to change the position. You can see this is the tilting movement of the prop. Just this tilting movement, you can see how it affects the view. See? So you need to keep the view you like most, or you can understand all the structure easily. So I think this is the best view because here I can see the clavicle just behind just below the subclavian artery. Now I will apply local infiltration using the insulin syringe. Using insulin syringe is very helpful because it is less painful and patient will not feel that painful needle insertion. So I will now freeze this section and explain everything. This is the plexus and this is the clavicle. And this is the pleural shadow. And this is the no-fly zone. Your needle shouldn't be below this line. And this will be our needle entry point, and our target is here, just right under the artery. So if you are confused, please go back and watch again this portion of the video. This is very much important to understand the relevant anatomy. So now I will introduce the needle, and I'm using 22 gauge spinal needle because it's less expensive and easily available here. And I'm not skipping the video because you will get to understand how I perform this procedure. You can see the needle is coming from the right side of the screen. You can see the tip. Just here, you will feel the pop. You will be inside the sheath, and you shouldn't hit those black dotted structure because those are the nerve. You shouldn't hit those nerve with your needle. So you need to inject the drug or hydrodissect. You can see here I feel the pop, and now I will aspirate and inject a small volume of drug. You can see that. So if you inject small amount of drug, it will disperse the nerve, and then you will able to go forward with your needle. So in this way, you can avoid the nerve damage or nerve injury, and the patient will feel pain if you don't hydrodissect, if you directly hit the nerve with your needle. So you don't actually need to go much closer to the artery. If you can go, it's better. But if you're not confident enough, you shouldn't go there. You can see I'm just going a little bit forward, and now I'm injecting again. So aspirate before every injection is highly recommended. So actually, you need to deposit drug in at two levels: the lower part of the brachial plexus and the upper part, and that will be fine. In this case, or I actually usually deposit 15 to 16 ml of local anesthetic here. In case of supraclavicular brachial plexus, I used to take 0.5% bupivacaine 12 ml, and I add normal saline 5 to 6 ml, in total 15 to 16 ml. I deposit here within the brachial plexus. You can see I'm injecting drug on the upper part of the plexus. So the main goal is to enter within the brachial plexus sheath and go just below the subclavian artery as closer as possible, and then inject drug at 2 level, and that will be good enough for the surgery. And you can see after injecting drug, the whole brachial plexus sheath is filled with drug. You can see that clearly. And here you can see the interscleral brachial plexus, but we will make a separate video for that. So thanks for watching, and please subscribe if you like my video. I will keep uploading some more procedure using ultrasound. Thank you for watching.